Well, this is Marissa from Health Source behind the camera shooting a video with a patient that has been a longtime patient of ours here at Health Source. She first started coming about 4 years ago, and we're going to hear a little bit of her story today. So welcome. So good to have you here. If you would just go over what your major complaint or symptom was.
The majority of it was in my neck and shoulders, from right below, clear down through the shoulders, and both of the arms.
And is there any things that you've tried on your own to get rid of the symptoms?
I've tried exercising. I've tried a lot of different things. Yoga. Another time going to a chiropractor for about 7 months, about 10 or 15 years ago, and he helped tremendously. So I knew that it was going to do a good job. And then I had fallen again before I came and fell on the stairs, so right between my shoulders was a big issue.
Awesome. What did Health Source help you do?
They set up a program where they tested me, took the x-rays, looked at what was wrong, and part of it was disc problems, and not necessarily crushed, but the swollen and disc problems. They helped me get my movement back. At first, the first week, especially the first week or two was pretty tough because it was basically frozen. The whole neck had kind of started to calcify and freeze up, and I could only turn about this far on my neck to get it to move, and I knew that if I didn't do something, it was going to be worse and worse, and then the pain was getting to be a constant. So they put me through the therapy. I went through the physical therapy, and at first I couldn't even, like the plank, maybe 30 seconds was. So a lot of it was getting the core back, getting the whole body back in shape, because I had been one of the typical patients and follow it for a while and then slack off and then don't do it. So.
Okay. What are some things that you could not do because of your symptoms?
I wasn't limited a lot, but when I was driving, it got to be harder to turn and be able to turn and see in the back. Sometimes it would catch, and that pain would shoot up. So it got where I tightened up more and more. But totally physically, sitting at the desk, it would become more and more painful.
Okay. How do you maintain the changes that you've worked so hard for?
Sometimes I goof off, but one of the main things, the Denerol that you guys prescribed, was one of the major things, and I lay on it at night before I go to bed. And it says to lay on the floor, but I actually just lay on the bed and put it behind my neck, and I can feel it starting to move that curve back where it needs to be. Because if I'm doing a long time during the day of working at the desk, you just kind of automatically start going forward and standing in the wrong position for too long time. And then a lot of times I'll use the Denerol first thing in the morning too.
Okay.
Especially if I've laid on my side, because that will start pinching right in here and here if I'm sleeping, and then pretty soon it's wake up and it's pinching very tightly.
Okay.
And then most days around noon I lay on the Denerol for a while and stretch out.
Okay.
And also I do the stretches, the neck stretches, and if I keep maintaining those, I can feel, and it will actually help keep it and put it back into location myself.
Okay.
The physical therapy.
Mm-hmm.
And then standing up straight. If I sit, I have to sit in the right kind of chair, and also standing and trying to do the core exercises. That's a lot of it.
Okay.
And if I don't, it doesn't take more than a day or two to know, and the body to say, I told you should have done that.
That muscle memory comes back.
Right.
So how about your monthly maintenance visits? Do you think those have an impact on your change?
They do, yeah. I think anytime you have a monthly maintenance or anything like that with anything, for one thing, it sets the body back right. Because even before, for quite a while, I came every 2 to 3 weeks. Doing it monthly now is about right.
Okay.
But if I go much more than that, then there are just things that kind of slide out of place, and even if I'm trying to do the majority of them.
Yeah.
Or you go out and get on the ice and slip, and and then you get to come back in.
Yeah.
Yeah.
Good. How do you think HealthSource has helped you improve your overall health?
In multiple ways. For one thing, when I first came in, I talked with Dr. Bob, and he said, well, you know, you need to go on a maintenance. And I told him, I said, hey, I've got too many years. I'm not going to be 30 years down the road. I have a friend that's younger than me that won't let anybody work on her neck. She's already having the same issues I was.
Mm-hmm.
I'm going to be 80, 90 years old and still be moving around. I'm not going to be, you know, crippled.
Right.
At
So,
least not because of HealthSource, or not because of back issues.
yes. So, would you recommend HealthSource to your friends and family?
I do.
And
I
then-
do often.
Awesome. Why would you?
Because of the program you do, and you guys are smiling when we come in, you know. You guys are always positive. You always work with us. You give my husband a hard time, and let me give him a hard time too. So, yeah, the atmosphere is good.
Good. What do you like most about HealthSource?
Just the overall program and the way you guys work with people, and your positive attitude.
Okay, awesome. Well, thank you so much for doing a testimonial for us. We certainly appreciate it, and look forward to posting some more here in the future.